morning, Jeff. Thank you so much for joining us. Everybody at home on this 1 year since the tragedy in Lewiston. We are live outside the Colisée in Lewiston, where a very special ceremony is happening tonight at 6 o'clock to honor all of the victims and bring this community together. We just spoke with a florist who's here right now as they prepare for the ceremony happening tonight. And she was telling us, several florists donating flowers to set up for this event, which is expected to be extremely emotional for all involved. But it is very powerful to see the community coming together for this.
Yeah, that is right, Katie. And it's so amazing to remember all of these people for who they were, not to remember them in the ways that they passed away, but to really deep dive into each individual and remember them for who they were. Over the next hour and a half, we're going to be going through what happened that night. We're going to be talking about the loved ones, the people who passed away, the emergency response crews that were here tonight on that night. And we're also going to be talking about the questions that still remain.
And you mentioned the emergency response. We're just about a mile from Central Maine Medical Center, where more than a dozen patients were brought for treatment the night of the shooting to be treated for their wounds. And I got the chance to sit down with the chief medical officer there at the hospital to learn more about their response that night, an award they received, as well as the lessons learned.
I was just walking in the door from coming home from work, and had gotten a call from our CEO, Steve Littleson, indicating that incident command was being activated and that there was a mass shooting. And so I quickly turned around and got back in my car and started coming back. During that period of time driving back, reached out to our head of security, our head of operations, trying to understand more of the details of what we knew.
Did you know right away the magnitude of the situation, or at what point did you recognize that?
It was obvious right away. It was obvious right away. Again, based on some of the numbers, I mean, we were hearing as many as 30 or 40 or 50 victims potentially. In some level, after the first wave of patients arrived here, we received a total of 13 patients here.
Did you feel like your staff, was well equipped to handle these injuries?
Yeah, our staff was amazing. The bravery and the expertise that they showed was just incredible. We had teams coming in from all over. We had anywhere from 100 to 150 team members arrive, including doctors and nurses and technicians. Our surgical teams, we had at one point 4 operating rooms running at one time, with multiple surgeons in each of those rooms. It's just not something that we usually do, but we do train for those experiences.
What were the next few months like? Do you know how long, the longest patient was with you for, and what was the feeling, as each patient was finally, released?
Our last patient, who was a shooting victim, left a few days before Christmas. That was really important to that patient. He had a family at home, and he wanted to spend that time at home. And for all of the patients who stayed with us more than a couple of days, we would line the hallways, our main hallway and our main entrance. Dozens of team members, nurses, technicians, support staff, physicians would line the hallway, and we would say goodbye to and congratulate those individuals for their bravery. But for the rest of our team, within a couple of days of the shooting, we began providing counseling services around the clock to all of our team members. We made sure that every one of our 3,200 employees had someone connect with them, ask them how they were doing, ask them what they needed, connected them with counseling services if they needed that.
So your trauma response team received an award from the Maine Hospital Association, is that correct?
That's correct, yeah.
Can you tell me about that and what that means, to you and the hospital and the entire staff?
Yeah, it's an incredible honor. The Maine Hospital Association annually recognizes a caregiver of the year, and traditionally that's been an individual who's identified for going above and beyond and having a huge community impact. And when we heard about that we were receiving the award, it's just an incredible honor to be recognized by your colleagues. Prior to that, we had shared with the Maine Hospital Association and many of our member hospitals some of the lessons that we had learned.
Can you share some of those lessons, some of the things that you have and will try to improve on?
One of the big ones was ensuring that we have a robust communication process in place initially. I mentioned that we had between 100 and 150 team members coming in to the hospital to help out. Most of the people who were coming in weren't called in. They heard about the event and they were coming in on their own to help out, which is incredible. Once that happens, you have to then assign roles to these individuals or have an area, what we call a staging area, for people to go to say, okay, I'm glad you're here, thank you. I don't have a role for you just yet. We didn't have a written plan in place for how we were going to take care of our 3,200 employees and our patients, not just the ones who were victims from the shooting, but everyone else who was here in the hospital, who also had a sense of being victimized and loss. We pulled it together very quickly, but that was something that we've now put more into a written plan, that now we know what we can do and how we can do it next time.
What else would you like our viewers to know, just as we approach that 1 year and your response and your experience and your staff's experience, that they could take away from our conversation?
I was one of the individuals who was interacting with the community a fair amount during that period of time. And for at least 3 or 4 weeks, we kept receiving donations of food and cards and other items of thoughts and memories from the community, just in support of our team. Tragedies naturally will do that, right? Bring people closer together. I think everyone always says, it'd be nice if we didn't have to have the tragedy to feel that closeness. And so I think that would be something I would share with everyone, that a reminder that we are one community, that we are here to take care of each other. Our hospital is here to provide health care, but our community provides care beyond that to so many members, and that's something that I think is important for us to remember.
And as you can imagine, blood was a critical resource for the hospital that night and for the days that followed. So CMMC also launched a campaign a few months ago with the Red Cross to try and collect 1,025 units of blood to mark this day, which is October 25th.
Yeah, Katie, so I actually spoke to Dr. Alexander myself a week ago today, and I was at one of those blood drives happening at CMMC, and it was just so amazing. They said that that extra blood supply saves lives. That was critical that night. They had several people coming in, and those blood donations helped save some of those people. So every extra blood that they can get definitely helps. And they said that they got blood from as far away as Boston. So they need it here. It's definitely critical.
It truly is. And it's so amazing to see people step up, especially as we mark this 1 year since the tragedy, that those donations are still desperately needed.
Yeah.
Jeff, we'll send things back inside to you for now.
All right, you guys, thank you very much.